I met Dr. Rawls about 20 years ago, and I can't say enough about Dr. Rawls. He was such a genuine man. He was such an awesome leader in this community and one of the first black surgeons here. I heard his story from his humble beginnings back in Florida, through his journey through med school at Howard University.
When you think about who is Dr. Rawls and what is his legacy and what has he brought to us, I wouldn't be here if it wasn't for Dr. Rawls. I wouldn't be here for all those who paved the way for me to give me the opportunity to be in an institution like this. Dr. Rawls was a general surgeon, and he worked, within the community. He ended up becoming very much involved in terms of the School of Medicine. And if you follow his pathway, every place he's gone, he's kind of left something behind to give opportunities and so forth.
Well, Dr. Rawls thought of this program because he felt there was a need to have more minority representation in the medical field. So Dr. Rawls went to the Center for Leadership Development because he had a relationship with Mr. Dennis Bland, who's the president of the organization. And then Dennis Bland met with Dr. Lisa Harris, who's the CEO here at Eskenazi Health, and then they just collaborated, and we have the Rawls Medicine Initiative.
When I was in high school, I went through the Rawls Scholars Medicine Initiative. And I knew I wanted to go into healthcare, but I wasn't quite sure of all the different professions that were out there, and I wasn't quite sure what the landscape looked like in terms of healthcare. So I think the program was really instrumental to me in terms of getting exposure to different healthcare professionals, because it was the first experience I had inside the hospital and just touring all the different departments that were here. So I think having that early exposure was really helpful for me in terms of kind of navigating the field of healthcare.
When you think about what students are gaining from this program, they gain so much from this program. For one, they gain the opportunity to see others who look like me, who are in different disciplines of medicine. I tell them about my story about how I got into medical school, so they understand that the pathway is not always an easy pathway. So I had to go through my trials and tribulations, so hopefully I mentor them and inspire them to reach their greatness.
What I've learned from this experience is I've learned hands-on activities and new medical things that I wasn't exposed to previous to this event, and how it will help me moving forward. It will help me pursue my dreams, which I aspire to be a pediatric surgeon.
What I've learned is that even though it's a long process, that if you're passionate about it, it goes by so fast. A lot of people think about the time, but the time is not really what matters if you're having fun doing it. So the time goes by so fast, like people are like, I gotta do 12 years of this, 12 years of that. If you're doing it, you never even realize that you're in school for so long. So it's like, I never really thought about it that way, because like if I'm passionate about it, I'm gonna have fun the whole time.
I think when we started, we didn't have a lot of tools because we were at our old facility, but when we moved to this beautiful facility here at Eskenazi Health, we were able to just give the students the opportunity to see more, to tour the hospital, to really be engaged and have a hands-on experience of what it takes to succeed in the field of medicine.
I hope they're encouraged by the fact that Eskenazi and CLD and Rawls is putting on this initiative to ensure that they're successful and to do everything that they can to provide students with resources and a network and a community that wants to see them be successful. So I hope they're just comforted in knowing that this community wants to see them succeed in their goals and aspirations. And I hope they also see some representation that it is possible to achieve their dreams.